My name is Kathy Avery. I am the nurse with ABIPA, and that stands for the Asheville Institute of Parity Achievement. And what we do is preventative health care. We do it in a holistic way where we're looking at three things. We're looking at people's physical health, their mental health, and their spiritual health. And we try to bring that all into focus so that when our outcomes are holistic at the end. And we also have one of our big things is our diabetic prevention program. And we try to do with that, we start at where people may be pre-diabetic, and we work with them to keep them from becoming diabetic, and we also work with the diabetes program as well for people who are already diabetic, and try to get them to manage their health care in a more realistic way where their outcomes are where they don't have those risk factors and those problems that come with being diabetics for a long period of time, like blindness and amputations and blood sugars that cause them to have heart disease or strokes or those sorts of things. So we try to teach them what they can do to manage their health. Well, the ideal participant is really anyone. As I said, they have pre-diabetes or that are diabetic. And the reason is we have two type programs. One, we work with and partner with Lambda Sky to do the diabetes chronic illness management. And for those people, they have to be diabetic. And I would think they have to be a little bit more ready to manage their care, and then we're kind of ready to go. But then I do a one-on-one program myself where we identify people with diabetes that may not be ready for anything. And what we do in that program is assess exactly where that person is, and it doesn't matter where they are. They could be absolutely nowhere, where they don't even know exactly what's going on with them, and they're so entrenched on their lifestyle and what they've done for the last 20, 30, or 40 years that we have to start like with one thing, which would be frustrating for a lot of agencies because, you know, people need to be ready. But the way we do things, we try to build trust and help you believe in what we do and believe in yourself so that we can take one step and then another step to get you where you might can actually even be transferred into some of the other programs once we get you ready. Well, the diabetes chronic illness program is a 6-week program. And that program is set that way. And so we can't make any changes in that, but we can go anywhere where people can meet. We got a lot of different places we can go. We can come to their places and fit them in where some of the places that we already are, like the community centers and some of the churches, or some place where they have people that like to meet. Okay, well, the second program, the one-on-one program, the length of that program is ongoing, and that program is a one-on-one. So that kind of really sums it up. It's us going out, finding the people that have the issues, the diabetes, and working with them one-on-one to see what it is they need, and then working with them as long as it takes for them to complete what we feel like can keep them in a more healthy level. The first program, the Diabetes Chronic Illness Management Program, is a program that was that the Lambda Sky uses through Stanford University. And as I said, it's a 6-week program, and it has a start where people learn about their diabetes, and then it has a component where they make a plan to treat their diabetes themselves, and they have goals. And through that 6 weeks, we teach them how to make their own goals and their own plans, and by the end of the program, they're learning how to, you know, as a chronic illness itself, they learn how to manage that and set their own goals so that when we let them go, they can continue with that and improve their health. The second program, the one-on-one, the goal to that is basically to have that person really identify that if they don't make changes, these things can occur. And they may not be ready to hear any of that or do any of that. So the goal is for them to find one thing that they might be able to change or do, and it could be very small. And it usually is really small. You know, like we have one client that the goal was, after about a month, was for her to remove the snacks from her bed and to put the snacks over on the table in the room. We didn't get them out of the room, but we did get them out of the bed. And it literally took a month for her to actually consent to do that and then do it. So those are the kind of things. So you see how much slower that program would be. So people in the first program, the Diabetes Chronic Illness Management Program, you would pretty much have to be ready to start making plans and implementing things in a more consistent and fashion in which you were ready to do these sorts of things. You can't be like this person because they would not make it through that 6-week program. Well, the 6 weeks diabetes chronic illness program, the goal at the end, as I said, is for people to make plans and learn how to implement those plans, and they learn how to change their eating habits. They learn how to self-manage their diabetes and weight loss and more exercise and eating better. So both programs are similar in that regard because the end goal for both programs is the same thing. It's the one is like 6 weeks, and when you're done, you know that person is going to make those changes and be ready to go. And in the second one, it may take 6 months to get to the first week of the other program. So the goal is the same, and so depending on which way we go is how ready people are to make those changes. Okay, in the diabetes management program, right now it's like 60, but our capacity is like 95. And so, we would like to get to that 95, so that would actually be excellent. The second program, there's no limit except with being able to make sure that I can manage however many people it is over a course of time where I feel like I was benefiting each person. So that would be the only restriction. And right now, that's not a problem. People are losing weight. And people call me and tell me that they're doing more walking, that they're changing their eating habits. And our overall church stories is each of our churches where people used to have sodas, they have water now, and they really want us to know. It's like, look, we've got water. Or they used to have fried chicken all the time, and now they have baked chicken. And so that's on the menu, and we've had people that never had fruit as a dessert that bring fruit. So those kind of changes is not like a one individual change, but it's like changing the whole culture and the whole community, which gives me a lot of satisfaction because that's what we want. We want to change the culture because by changing the culture, you change the individuals.